Hi, I'm Dr. Jessica, and I'm here with Chantal. She is a hygienist that works out of Grandview Dentistry. And so, Chantal, why don't you introduce yourself and how you got into hygienist school and like what your role is within the clinic now?
Perfect, absolutely. Well, hi, I'm Chantel. I am a dental hygienist over at Grandview Center for Dentistry. I've been a hygienist for about 12 years now, and I got into dental hygiene because my dental hygienist thought it would be a great career path for me. I was really actually a theater major going to college. And when I decided I didn't want to be a starving artist anymore, I looked into what else I was good at, which was talking to people and science. And my hygienist thought it would be a great idea for me, and it was. It's one of those really fun careers that I still get to interact with people on a daily basis, but then also help them just achieve overall health.
That's amazing. And
Yeah.
then how did you kind of expand how does the hygienist role kind of tie into what you're doing now as like a oral myofunctional therapist within the clinic?
Yes, yes. So, one of the big things that I realized really early on in my career was that my patients kept asking me questions that I didn't know the answer to. And some of those questions, I mean, the big one that sticks out is why is my 3-year-old grinding their teeth at night? Are they stressed out? And I didn't know the answer to that question.
Right.
A lot of my patients also suffer from jaw pain or discomfort or TMJ pain or discomfort. And we kind of know that, oh, you're probably doing some kind of dysfunction at night, but we don't know the why are they doing it. And
Right.
so I started to kind of search for the why versus here's a night guard, you get a night guard, and you get a night guard. Which is, no, I mean, in modern medicine, we have all sorts of band-aids to help these symptoms, but we don't really get ever down to like the nitty-gritty of the why. And when I started getting down to the nitty gritty of the why, that is when I stumbled across like airway focused dentistry and function, and how dysfunction plays a role into that.
Oh, that's
And
amazing.
so I stumbled across something called oral myofunctional therapy, which helps people with tongue ties, with allergies, with obstructive sleep apnea, jaw pain, TMD pain, and allergies as well. And let me tell you, it is a whole rabbit hole to go down to, and there is so much information about it. It's very interesting.
Yeah. Could you tell us so what is oral myofunctional therapy? So you do it with like a lot of different conditions with the mouth, but are you honing in on like certain exercises or certain like different ways people are positioned either at night versus like throughout their day while they're at work or anything like that?
A little bit, yes. So I would say the majority of the patients that I work with are people who have discovered that they have a tethered oral tissue or a tongue tie.
Okay.
And they have been looking for a provider to do what we call like a tongue tie release. Um, and those people specifically need myofunctional therapy as more of a physical therapy aspect to help to prepare their tongue for the surgery that they will be undergoing and then support them afterwards. When you have a tongue tie or that tethered oral tissue, your tongue's mobility is very limited. And if we were to just release it or, free willy back into the into the wilderness, we're going to have a lot of complications and problems, and it can potentially make all of the symptoms that you're experiencing worse.
Okay.
So oral myofunctional therapy is more designed like a physical therapy aspect, but to help train the lips, the tongues, the cheeks, and the swallowing muscles.
Oh, that's amazing. And you do it on all ages, correct?
So we try to do it ages like 6+, only because I there are people who specialize in younger children. And
Right.
bless them, because one of the hardest things to teach about myofunctional therapy is mindfulness. And mindfulness is, it's hard for teenagers, it's harder for adults. And the people who specialize in younger children definitely have that touch to kind of help teach mindfulness in a way that a child understands versus a young adult would understand, or adults too.
Right. Okay. So when you guys are doing the releases at the clinic,
Yes.
ideally you'll step in before the revision and afterwards, or solely just like afterwards retraining process.
It's usually a before and an after process. We like to support some muscles and strengthen a couple tongue muscles and lip muscles so that you can be prepared to have a good revision. One of the exercises just teaches you how to move your tongue separate from your lower jaw and how to open as wide as you possibly can in that posture so that the revision can be done. We can place some nice sutures for you. You can heal well, and then that's when the real muscle building kind of starts afterwards. So it's a little bit of before and after.
Oh, that's amazing. So when you were going through all of this schooling and everything like that, I know for chiropractic school, we do a ton of like exercises and stuff. And while I was going through it, I was like, oh, I need to start doing that. I need to start doing that. Did you find the same thing with you? Like you wanted to figure out your own tongue type of thing?
Yes, and I figured out very early on that I've had a tongue tie my whole life, and that is more than likely why I had to have my tonsils out when I was a child, why I had my adenoids out, why I still struggle with allergies and postnasal drip, and no
Okay.
matter what I do, it's not getting better.
Right.
And so, yes, you find out so much about yourself. And then how does that translate into dental hygiene? I see it in every single one of my patients, and you just want to like scream it from the rooftop. So,
Yeah. Oh, absolutely. So
yes,
even if the person or the kiddo is not getting a revision, do you help them with some of these exercises as well when you're just doing
absolutely.
your normal day-to-day job?
I try to. I try to educate and give little nuggets here and there. And the biggest thing that I like to talk about is nasal breathing versus mouth breathing.
Okay.
Nasal breathing is one of those most important thing that we can do to really help to grow a really healthy jaw structure and a nice wide palate so that we have an open airway that our tongue can fit into. And so if I ever see my kiddos in my chair and I notice that they are breathing through their mouth or they always have like a blocked nose, just educating the parents and saying, hey, maybe we should talk to an orthodontist to see if we can open up this airway first before we, can can start actually doing a physical therapy structure with them.
Right. Okay. And then um leading into like more about that palette and everything like that, do you like it starts from a very early on young age, correct, with the tongue resting up?
Yes,
Okay.
correct.
And
Yes,
then,
absolutely.
so do you find that with doing the revisions and everything like that, once we can get the tongue up, do you see a lot of changes with the palate, the arch, as the kiddo grows into their more like kid and adult mouth, I guess?
Yes, no, great question. Yes. So the younger we can catch it, the better. If we can catch these symptoms before growth spurts, and we can get the support from an airway focused orthodontist as well as a dentist who is looking for those things and really help to get that tongue up to the roof of the mouth, that's when we're going to see wider palates, those big wide smiles, and a nice square jaw versus the like a long skinny face, if that makes sense.
Okay.
Yeah.
Yeah.
Um, and honestly, one of the best times to catch it is in infancy.
Okay.
So if a mom is struggling with breastfeeding, or I mean, there's so many different symptoms, and doing a revision in infancy is usually a really quick and painless procedure to help the jaw grow very large rapidly by the time that they are like 2, 3, 4 years old.
Oh, that makes sense. That makes
Yeah.
sense. And you guys do revisions in adults as well, and just retraining the tongue pre and post as well.
Yes, we
Do you
do.
guys find a lot of like palate changes with the older the individual, or not necessarily, but just improved function?
I see more improved function, only because in most adults, that palatal suture is closed, usually around like age 16, 17. Um, so I don't see a ton of changes with the palate unless you go through some type of orthodontia that would help to expand the palate a little bit.
Okay.
There are always options. I know Dr. Zaghi at the Airway, the Breathe Institute out in California, he's kind of going through his own airway expansion at the moment, where he actually did a palatal expansion as a 50-year-old man. And he has all the room for his tongue now. And it's a lot to go through. So
Seems
it really,
intense.
it's intense. But it can be done. It can be fixed, but it's a journey. It's a long journey, and there's a lot of steps to it with many different professionals to go through it with, but it can be done.
Okay. That's amazing. Is there any like early screening that you guys are looking out for during your routines or anything like that? Like what kind of symptoms or extra things
Yeah.
are you like looking for with everything?
Yeah, so symptoms and things that we're looking for in screenings would be large tonsils, a very large tongue, and a very narrow mouth, or any kind of crowding in children. Children's teeth are actually supposed to have pretty decent sized spaces in between them, and if they're all kind of together and touching, that's a big indicator that their airway isn't large enough for them. Any kind of wear on their teeth is not, it's common, but not necessarily normal to have in children. That's a sign that they might be doing some dysfunction at night to try to open up their airway and sleep better. And other symptoms to look for would be grogginess in the morning. If your child's constantly getting up in the middle of the night, that would be, outside of normal. Like maybe they're waking up every 45 minutes or so to turn over or to get a drink of water. Night sweating, bedwetting over an age that would be appropriate. And a lot of tossing and turning would be signs that the child is not sleeping well, and that would point to airway as well.
Does that kind of correlate with like sleep apnea later in life as well? Like, is
Bingo.
is like
Absolutely it
why
does.
we have a lot of sleep apnea?
Yes, it really does. And the more research we do on sleep apnea, the more we're finding out that it's a preventable disease.
Oh my gosh, that's
I
incredible.
know, right?
Mind blown.
Yes,
I
yes,
love it.
yes. So children who are having sleep issues or are poor sleepers, it usually leads to a poor or a small airway or large tongue, or different things that can be retrained or worked on, so that that child doesn't grow into an adult with sleep apnea.
Oh my gosh, that's incredible.
Yeah, isn't it?
That's amazing.
Yeah.
Does that also like, so let's just say kiddo is 6 plus, maybe even 10 plus type of thing,
Yes.
and we do not want to do a revision, even though there is that tethered oral tissue. Can those individuals still benefit from a lot of like stretches underneath the tongue and like doing different exercises to help with that airway? As
Absolutely.
okay.
Absolutely. A lot of my patients who do go through oral myofunctional therapy, many of them don't want to have their tongue tie released, and that's completely fine too. My four goals with myofunctional therapy are tongue up, lip closed, healthy breathing through the nose, and proper swallowing. And
Okay.
so, if we can achieve those four goals, even if the tongue is still restricted, they're going to have a better chance of having a healthy developed skull, and other healthy habits throughout their lifetime that can help prevent those diseases like sleep apnea, or even, allergy symptoms and TMJ pain and grinding and clenching. So it's a lot to do with that nasal breathing.
Oh, that's amazing.
Yeah.
Oh my goodness, the mouth is just incredible. Like
It is.
literally.
It's the beginning of your airway, it's the beginning of your digestive tract. It's the first thing that people see when they meet you. It's how we communicate. It's a lot of things.
Yep, exactly. Oh my goodness. And like it provides so much like information about your health just starting right here. Like,
Yes,
oh,
yep.
that's incredible.
And what I always like to say is that as a dental hygienist, I spend a lot more time in your mouth than your medical doctor ever does.
Right.
If you come in for a routine cleaning, I'm in there for 20, 30, 45 minutes sometimes. I'm looking at way more than just your teeth and gums. I'm looking at that airway. I'm looking at your tonsils. I'm looking at all of your tissue. I'm screening for oral cancer. But now I'm asking the questions of how do you sleep? Maybe we do need to get you into a sleep study, like tell me about your dry mouth and are you, drinking enough water or are we on so many medications that we need to correct this dry mouth? So the functional aspect in our dental practice is really, really huge because it not only helps to get people healthier, but helps to keep their teeth healthy for life too. Everybody's keeping their teeth. It's the cool thing to do. So
It's,
that's my
it's
job. I want you to
the
keep your
new
teeth.
cool thing, right?
Absolutely. You keep those teeth till you're 150 if you want them. So
Absolutely. And have you ever seen like mouth breathing correlated with like ADHD or any sort of behavioral issues at all?
absolutely. ADHD is definitely linked to kiddos with airway issues, adults with airway issues as well. And the thought behind it is that when they're not breathing properly, they're not sleeping properly. And in children, sleep deficit is opposite of adults where they present more hyperactive. Whereas adults, when we're in a sleep deficit, we are tired, we can't get out of bed. Kiddos are bouncing off the walls. They have all the energy and they have a really, really hard time focusing because they're in that sleep deficit.
That's so amazing. That's
It
so like
is
just overall interesting to know that like
so interesting.
the behavior and like just how our brain develops just correlates so much with everything that goes on
Yes,
starting,
it's
right?
such an amazing rabbit hole to go down for sure.
Well, thank you so much, Chantal.
Absolutely.
That's all the questions that I have. Thank you
Good.
so much for being here today and for your vast amount of knowledge that I'm so excited to learn more about. And
Absolutely.